am 36. People comment all the time how tired I look. What are my options? Here are a few photos with and without makeup. I look very tired around the eyes. Is this something a cream, Restylane, or surgical intervention could help? Please advise. I'm ready to look awake.
Thank you for your question. You've submitted some photos with and without makeup, and you are asking whether or not creams, Restylane, or surgical intervention can help you with looking tired. And certainly the photos you've submitted are very, very helpful, and you state you're 36 years old. So why do the eyes look tired? Well, as a practicing cosmetic oculofacial plastic surgeon for over 20 years, I could tell you that in Manhattan and Long Island, the phrase we get to hear almost every day is essentially, "I'm tired of looking tired." And the reason is that the eye area really projects so much about how you feel. And so when you have puffy bags under the eyes and you have dark circles, it really communicates fatigue, sadness, and of course, lack of energy. So what we do when we're doing an evaluation is look at a few things. First of all, it is possible to have more than one issue. Therefore, you need to have more than one solution. Currently, it's very popular to use fillers of different kinds, most in the hyaluronic acid family, to help soften the transition between the puffiness under the eyes and the adjacent area or the tear trough. But let's learn first a little bit about the anatomy of what's going on. Let's start with the puffiness. The puffiness is due to something called lower eyelid fat prolapse. This means that fat pockets that are normally around your eyes pushes forward and herniates. We call it herniated fat. And it creates a bulge. Now that bulge accentuates an adjacent area called the tear trough, which makes it look more hollow and creates this dynamic where it looks like you have these deep dark circles and you have the puffy bags above it. Now a lot of times there's also volume loss in the eyelid cheek junction, or an area we call the V deformity, where there is, when you're younger you have more volume, and a lot of times genetically or with weight loss or combination you lose volume in this area. So looking at the photos you have submitted, you could consider a combination approach before considering surgery. Ultimately, the puffy bags under the eyes need to be operated on. You can't treat them non-surgically. There is no way to address the fat pockets without performing a surgery. However, you can maybe buy some time, and since it's a photo you're submitting, I can't get a three-dimensional sense. I can only get some degree of sense of the shadows. But a lot of times what we have been very successful with is a combination approach, and a combination of using platelet-rich plasma, and this is derived from your own blood, and it's using the healing growth factors necessary for wound healing and concentrating them. We find that when we place this material, this is from your own blood, that is placed under the skin, it creates this improvement in skin quality. And then when we combine that with a filler such as a hyaluronic acid like Restylane, there's a real synergy between the two, and we get some very, very nice results. It's very important to understand there's an upper limit on how much volume you can place under the eye area. We see patients all the time who have had way too much filler placed in, and we actually have to dissolve that filler out using an enzyme called hyaluronidase in order to reveal what's going on underneath. A lot of times very well-meaning doctors do a very artful job, but they just make the cheeks look so big that the person is almost unrecognizable because they just have too much material. So strategy really can be also, an alternative strategy I should say, is addressing the fat pockets and then considering adding volume below the area of the fat pockets. It's kind of a very unfair reality is that you have too much volume in one area and not enough volume in another area. So in answering your question, for a lot of our patients, it's a combination of surgical treatment, filler, platelet-rich plasma, and yes, as well as topical creams to help with superficial issues, whether it's retinoids and good moisturizers, sunblocks, etc. We have our own skincare product line, and certainly it helps support what we do, but no skincare product can get rid of bags under the eyes. And so I think you have to meet with some doctors and get some opinions to understand how all of this can be handled. There are definitely, you're going to see a lot of different approaches, and you just have to feel comfortable with the rationale. And for us, a lot of times, it's an education process. You know, a lot of people are afraid of having surgery. And so they want to first try the non-surgical option just to learn and see if they would be satisfied. They may not feel like they got everything they wanted done, but maybe they feel like they look good enough and they're happy before they move on to surgery. So there's nothing that's always black and white. Unless someone has really, really big bags under their eyes, then there's no point in even discussing fillers. But in a case like yours, there may be some room to be a little creative. So I hope that was helpful. I wish you the best of luck, and thank you for your question.